Asthma is a chronic inflammatory disease of the respiratory system, characterized by bronchial hyperresponsiveness, episodic acute asthma exacerbations, and reversible airflow obstruction. Asthma causes symptoms including shortness of breath, cough, and wheezing. It commonly presents in childhood and is usually associated with conditions such as eczema and hay fever. The overall etiology is complex and still not fully understood, but it is agreed that it is a multifactorial pathology influenced by both genetics and environmental exposure. The pathological process is thought to begin with exposure to a specific trigger. This can be inhalation of an irritant, such as cold air, or an allergen, such as pollen, which then, due to bronchial hypersensitivity, leads to airway inflammation and an increase in mucus production and airflow obstruction. Airflow obstruction in asthma is caused by three main pathological processes. These are the inflammatory cell infiltration, mucus hypersecretion with mucus plug formation, and smooth muscle contraction. These reversible changes may become irreversible over time due to basement membrane thickening, collagen deposition and then fibrosis. Airway remodeling occurs in chronic disease with smooth muscle hypertrophy and hyperplasia. There can also be infiltration of eosinophils, specialized immune cells that play a role in allergy. This would be termed chronic asthma with airway remodeling. Fortunately, many children don't get to this stage thanks to advancement in asthma treatment. However, simple asthma does cause symptoms, namely wheezing, shortness of breath, and a cough, which is often worse at night. The wide range of triggers of asthma can exacerbate symptoms of asthma at any point, and this is termed acute asthma. These triggers can be divided into avoidable and unavoidable triggers. Avoidable triggers include cigarette smoking, allergens such as animal allergens, mold, or pollen, airborne environmental irritants such as cold, dry air, perfumes, home renovation materials. Medications can trigger asthma such as aspirin, non-steroidal anti-inflammatory drugs, and beta blockers. Dietary triggers include food chemicals and additives. There may also be unavoidable triggers such as respiratory tract infections and exercise. The diagnosis on asthma slightly differs depending if one is very young or older. In children, typically, the diagnosis is based on history and examination with clinical improvement by using bronchodilators. However, when a child is old enough, they can be diagnosed with a pulmonary test, which after using bronchodilator will show reversibility in airflow obstruction. Treatment of asthma involves assessing the severity first, then using a stepwise approach in the management of asthma by using relievers and preventers. The most common reliever is salbutamol, which is a short-acting beta-adrenergic agonist. Other inhalers include antimuscarinic inhalers. There is also corticosteroid inhalers with combination treatment. If after a stepwise approach asthma is still poorly controlled, other agents can be used, such as montelukast and monoclonal antibodies. A common one used in asthma are those monoclonal antibodies that inhibit the action of eosinophils. Then it's important to note the non-pharmacological management of asthma. This includes inhaler techniques and understanding the importance of good adherence. It's important to have an action plan, a plan to implement if one has an asthma exacerbation, characterized by worsening shortness of breath and wheeze, for example. If someone who has an exacerbation of their asthma, termed acute asthma episode, that is not responding to their action plan, this is a medical emergency. Generally, acute asthma episodes can be divided into mild-moderate, severe, or life-threatening. In mild to moderate acute asthma, children can speak in whole sentences, they're still moving around, and their oxygen saturation is above 94. In severe asthma, children are dyspneic. You can start seeing use of accessory muscles. They're unable to complete sentences in one breath, and the oxygen saturation is between 90 to 94%. In life-threatening asthma, they have reduced level of consciousness. They are exhausted. They can be cyanosed, hypoxic, less than 90%, with soft or absent breath sounds. Treatment of acute asthma is usually an escalation method, whereby in mild to moderate asthma, you always begin with bronchodilators, beta-2 agonists, and antimuscarinic, either via nebulizer or inhaler. Then in severe asthma, you start adding on corticosteroids, whether oral or intravenous. And then in life-threatening asthma, the addition of magnesium sulfate can be used, aminophylline, adrenaline as well. At any stage, the use of non-invasive ventilation and even intubation may be used. So in summary, asthma is a chronic inflammatory disease of the lungs, characterized by shortness of breath, cough, and wheeze. It is a reversible lung disease with the use of bronchodilators, which is first-line treatment. Thank you for watching.